Hello and welcome to another edition of For the Health of It. I'm Lou Beccaria, your host, and thanks for joining us once again today. There's probably not a more relevant topic today in healthcare than that of drugs in general and substance abuse in particular. We hear about it every single day. In the interest of helping you become a more informed healthcare consumer, we thought it would be a good idea to have a show with a local pharmacist who can speak with us about the proper use of medications and how to avoid their misuse. We'll also be touching upon opioids and the ravages that these drugs can cause individuals and their families. With this in mind, we've invited Mark Szilagyi, a pharmacist with the Gateway Pharmacy here in Phoenixville, to talk with us about these two topics. Mark, welcome to the show. Thanks for being with us.
Thanks for having me, Lou.
So, tell us a little bit about your background for those viewing who may not know about Mark Szilagyi.
I was born in the Phoenixville Hospital in 1982, many years ago, and I grew up in the area, and I graduated, and I started to work at the Gateway Pharmacy in Phoenixville, and I became a pharmacist, and I've worked there ever since.
Okay. And where'd you go to pharmacy school?
I went to the University of Sciences in Philadelphia.
Okay, that's like a premier place to go to become a pharmacist.
It's a good pharmacy school, yes.
Yeah,
I'm glad they let me in.
So, I'm sure there wasn't a problem. So first, let's talk about the use of drugs that the average person uses, okay?
Sure.
So what is the proper use of drugs and handling drugs at home or if you have little children, to keep them safe?
Well, it's actually really important. It's easy to drop a pill on the floor, or it's easy for your pet or your child to get a hold of medication. So honestly, it's very important to know where it is and keep it in a safe spot. The one thing that I do recommend is keep all of your medication in the same area. If you feel like you need to lock it up, that's not a bad idea. They do sell little lock boxes that you can put your medication in. So making sure that you're aware of where it is, and honestly, making sure you don't have too much. Sometimes what happens is people will get a prescription, and then they'll say, oh, I'm running out, but I'm not completely out, and they'll go get another refill. And now you've got 2 bottles of medicine. And so you want to be really careful about medication having too much on hand, particularly if it's expired or if it falls into other people's hands.
Expiration, like what is a normal expiration for a regular drug that somebody would take?
It's a good question. So the expiration of the actual medication can vary because it's going to depend on when you got it from the pharmacy. Typically, I recommend 1 year from the date that you picked it up from the pharmacy. If you have something longer than that, then you probably either need to see the doctor again and make sure that you should still be on it, or dispose of it.
Yeah. With all that's going on in today's world about the misuse of drugs, what are some of the warning signs that a pharmacist would have about potential misuse of drugs with somebody? For example, is it a warning sign if a person has traditionally been getting 30 days worth of whatever the drug is, and all of a sudden they're asking for 3 months worth on a regular basis? Is that a red flag? Or
the concern I would usually have with something like that is if someone was coming back more frequently than 30 days. So a lot of people are concerned, and we live in a hectic lifestyle where you want to get something when you need it. The problem that runs into is if you have 30 days and you're coming back in 2 weeks, that's a little bit of a red flag for me.
Okay.
You have 2 weeks worth. You should have plenty of time to use that and then come back and see me when you used it up.
Yeah.
And it goes back to the idea that you don't want to have too much medicine on hand because that can fall into the wrong hands.
Yeah. I'll tell you how squeamish I am about that. If I have sometimes when I've come to your pharmacy, if I have 1 pill left, I'm thinking they're going to think I'm like a drug addict or something with this,
No, I mean the idea is to really try to coordinate it so that when you're running out, you're getting a new prescription or getting a new refill. And so, that's a hard thing to do. There's a lot of programs. I know at the Gateway we have a couple that we can coordinate you so that you're due at the same time, so you're more on a schedule. That's the important thing. It can be very confusing to have a lot of different prescriptions. Sometimes you get one day and then you run out the next 3 days later. So it's an ideal scenario to sort of coordinate it so that you're due at the same time each month.
Okay, yeah. You touched upon something that I've always wondered about every time I take the medications that I have to take. It's like the interaction of the meds. Right. How do doctors and pharmacists keep all that straight?
Well, it's really hard. It is. It's really a difficult thing, and it's a big part of our day. The one nice thing is that most of our, all pharmacies have a program where when we put a new prescription into the computer, it does pull red flags. Now, you'd be surprised how many frequently drugs interact with other drugs, but we have to evaluate what is important and what isn't. And for the most part, most drugs are developed to be very safe and effective for patients. So the really bad interactions are very few and far between.
Okay. One of the things that gets me on television is the commercials for various drugs. Is there are so many qualifications. It's like, I wonder, it's like, why would somebody want to take the drug if, they got a list of 15 different things that could go wrong, some of them pretty serious.
Yeah, exactly. And so I think that's more of a legal thing. What a lot of these drug companies have to do is sort of present every possible scenario, and some of them sound pretty terrible. It just kind of goes to show you that, while we're taking a medicine and it's developed to do something for you, there is always issues that could arise, and you have to be aware of those issues. Being informed and knowing that there's a potential dangerous drug interaction is important for the patient because they may ignore it, and you don't want to do that.
Yeah. Sometimes I take my meds in the morning, but sometimes in my normal scenario of things that I'm doing after I get up, I forget whether I took the drugs or the meds or not. Can it be harmful to take two doses of it when you forget, did I take it already, and you feel it's a necessary drug?
It's really important to sort of ask your pharmacist specifically to the drug, but for the most part, if you skip one day, it's not the end of the world.
Okay.
So if you get to the end of the day and you're like, I cannot remember if I took it, I would say maybe wait until the next day.
Okay.
Maybe take it a little bit earlier than you
that's a safer approach than trying to take two just to make sure you took it.
Exactly. And so I think the thing is that you have to remember, when you take a pill, it doesn't just work. It has to get into your system. And so pills don't work right away. They have to be in your body, and you have to have a certain level to work. So to have that, to miss one pill, not probably a big issue. Just start normal the next day. It would be a lot more problems if you doubled up.
Okay.
So my recommendation would be not to do that.
I'm glad I asked the question, Mark.
There you go.
Okay. All right, we're going to take a break for commercial, Mark. You're watching For the Health of It, and we have the pleasure today of talking with Mark Szilagyi, a pharmacist at the Gateway Pharmacy in Phoenixville. We're going to hear more from Mark about different aspects of the use of medications. We'll be right back. Hi, welcome back to For the Health of It. For those of you who are just tuning in, we have the pleasure today of talking with Mark Szilagyi, the pharmacist at the Gateway Pharmacy here in Phoenixville. And we're talking about the proper use of drugs, and we're going to get into opioids in a minute or so. So, when we have drugs, Mark, that are expired, what's the best way to handle that situation?
Well, that's actually a great question. A lot of people, 75% of people who abuse pain-relieving medications actually get them from their relatives or people they know from their home. So it's really important that if you have expired medication that you don't intend to use, to dispose of it. Most municipalities will have a drop box or an expired medication box where you can take that medication and they'll dispose of it, no questions asked.
Okay, so you just bring it, put it in a bag or something and bring it?
Yep, exactly. So the Phoenixville Police Department has a box. Put your things in it. What I usually do recommend is take your name off the bottle, just for good reason. Take it to the Phoenixville Police Department box. They have it, it's sort of like a little, like a drop box. Drop it in there and it's disposed of. You do have to be careful. They don't take certain items like needles or use syringes, but they do actually take liquids, which some police departments don't take. So that's actually a really good thing. Okay.
Well, you brought up needles. What's the best way to dispose of needles?
Excellent question, because I get this question all the time at the pharmacy. So what I usually recommend is to get two products. One is to get a needle clipper, and two is to have something to put the needles and the syringes in. That could either be a sharps container, which many people have seen. It's like a big red box. It says biohazard on it. It's thick, strong plastic. Or if you don't want to purchase one of those, use thick plastic containers like a bleach bottle or a laundry detergent bottle. So then what I recommend to do is take the top off, use the needle clipper and clip off the needle tip, put that in there, and then throw the syringe in. You can fill that up. Don't fill it all the way though. Leave it to about 3/4. You don't want to overfill it. Close the top, seal it with some tape. You can actually throw that in the trash. That is allowed. But you do want to make sure you never put anything like that in the recycling bin.
So why do you fill it up 3/4 with liquid?
Well, I guess the idea, well, no, you just fill it up 3/4 with syringes.
With the syringes,
Yeah, don't put any liquid. Yeah, you don't want to put, you actually want to try to keep that as contained as possible. Anything in there you want to try to keep in the plastic, and that's why it's really recommended to use heavy, thick plastic, not like a soda bottle, but like a thick, strong plastic.
But then after the bottle is filled up, you can just put it in a regular trash?
Right in the regular
trash.
Yeah, absolutely.
Now, the first option that you talked about, Mark, are they available at Gateway Pharmacy?
Yes, we do sell. We sell both items. They're very reasonably priced. The Sharps containers are great because they have like a little slot for it, so it just pops right in. You'll avoid any sort of needle sticks, and that's something you definitely want to avoid.
Okay, great. What are the drugs that are, how can I put this? The drugs that are most susceptible to being misused, are they the pain medications? Are they heart medications? Or what are they?
It's a good question. Primarily what we're seeing problems with is mostly the pain medications. We've all heard of oxycodone, hydrocodone, drugs like that. And for years and years and years, they were used in small quantities. And in the last couple of years, they were a bit overprescribed. And it really started to become a real problem in the area. So typically, pain relievers like oxycodone or hydrocodone are ones that are abused. Other issues.
What's the difference between them?
Oh, well, actually, what the difference is not much. One is a little bit considered stronger. So oxycodone is a little bit stronger than hydrocodone. They're both very strongly controlled, meaning you have to have a handwritten prescription from a physician or an electronic prescription sent over. But they still fall into the wrong hands sometimes.
Yeah. Now, am I correct in understanding that recently there was legislation passed in Pennsylvania where doctors are limited as to how many of those kinds of drugs that can be prescribed at one time?
Well, so the really good thing is after this epidemic hit, people really realized that we have a problem. And so on my end, what they developed was called the PDMP, the Pennsylvania Department. Anyway, it's a website that sort of tracks any oxycodone or any pain relieving or controlled substance pain medication that's been dispensed. And so it gives everyone the opportunity to see where things are coming from and who's getting them.
Okay, so what is it with those drugs that make them so dependent?
That's a good question. So when a drug becomes a controlled substance, there's two issues. One is your body becomes used to it and you require more. Also, it can cause a good feeling, like a calming feeling. And so when you combine those two things together, it's really easy for any person to sort of want to use it more and more. And unfortunately, as you use it more and more, your body becomes more used to it, and then you just require more. And that's really why it's such an insidious problem, is that regular people who are prescribed just a little bit of medication start to use it, and their bodies just become used to it. And it's really unfortunate.
Yeah. Just moving aside a little bit from the regular script here, what are some situations that maybe in your years as being a pharmacist, situations that you've run into that may be very unusual in terms of how people may use drugs or what they're asking for or conning you? That kind of thing.
Yeah, I mean,
does that happen like almost every day?
It's interesting because you'd be surprised how candid people are when they come into the pharmacy. Most people are pretty honest, and they've told me some funny things. One big recommendation that I learned on early was to always tell patients to take the foil off of the suppository, because people may not do that when they use that. And someone did do that, and I had to send them to the emergency room.
Oh,
so,
my God.
Really not a pleasant story, but kind of funny if you think about it.
That's part of, you don't teach you that in pharmacy
No, they
school,
don't.
right?
I never learned that, and I learned on the job. So.
Okay. All right, Mark, we're going to take another break for commercial. Okay, you've been listening to Mark Szilagyi, pharmacist from Phoenixville's Gateway Pharmacy, and we're going to come back and talk more about some of the issues that you really need to learn about the proper use of drugs. Stay with us. We'll be right back. Hi, welcome back to For the Health of It. I'm Lou Beccaria, your host, and we have the pleasure today, for those of you who are just tuning in, of talking with Mark Szilagyi, a pharmacist at the Gateway Pharmacy here in Phoenixville, about all different aspects of drugs. So one of the things I'd like to ask you, Mark, is what is the difference between the brand make of drugs and the generic drugs, and why is there a difference?
It's a great question. So a lot of times what I'll tell people is, well, the price. But there is a little bit more to it. So the brand name drug is a drug that was developed by a manufacturer. And they did all of the science and the effort to put that drug together, to make sure that it works, and to make sure that it's safe for you to take in a lot of instances. So what then happens is since they put the money and time and effort into developing that drug, they're given a patent on that drug. And they're allowed to be the only provider of that medication for a certain period of time. And so after that period of time is expired, other manufacturers are allowed to make the medication.
What's usually the patent time?
It's typically about 7 years.
7 years, okay.
It can be extended. So if they make a drug for one disease, it's usually about 7 years. But then if they figure out that that drug works for another disease, they can extend that patent for a longer time. So that's why you may have been on a brand name drug for 10, 20 years, because they keep coming up with new reasons for it to work.
Okay, so generic drugs aren't watered down drugs, so to speak.
No, not at all. That's a good question. Some people do think that, actually. Yeah. So generic drugs are the same medication, active ingredient, but they're just made by a number of different companies. And so it's sort of the supply and demand idea is that once more companies are able to make something, they're going to drop the price, and then they're going to sort of compete. And that's why generic drugs, while people think that they're cheaper, they're actually not. They're just more inexpensive.
Okay. Well, what's the difference between cheaper and inexpensive then?
Well, cheaper sort of has a connotation that it's not as good, it's not going to work. But more inexpensive says it's the same thing.
Same quality.
Exactly, same quality.
Yeah. Yeah. You mentioned that it takes a long time to do the research and so forth to bring the drugs to market. Approximately, in general, how long does it take from the concept of the drug to actually putting it on a shelf?
Well, it really depends on how much money they have to make it develop. Some drugs can happen within a couple of years. Some drugs can take decades. It's important that not only do they make sure that the drug works, because years past, people would make drugs and they would work, but there were definite side effects, and they could definitely cause harm to people. So in today's age, not only do we want to make sure that it works, but we also want to make sure that it's safe for patients, and safe for patients in a lot of scenarios. There's a lot of medications that people take, and they have to take that into account. If they're starting a new drug, does it work? But is it also going to keep people safe?
Yeah. One of the things I'd like to ask you, and I guess it's because maybe I'm getting older, is sometimes it's really hard to read the directions. It's so small,
yeah.
Especially for older people when your eyesight is not as good as when you were younger. So, do you advocate for people to use a magnifying glass so they can see it?
Actually, I do. I think that's an excellent idea. I have a couple patients who come in with magnifiers. We had a person that used to work in the lottery department, and she always had a magnifying glass to make sure that she got the numbers right. And so really simple tricks like that are good. I think also just having a good conversation with your pharmacist and knowing them and being able to call them and ask them, we're there. I always tell people they don't pay me to count pills. They pay me to counsel you and to talk to you. So if you ever have a question or you're concerned or you forget or you can't read your bottles, give us a call. We're always available for questions.
Okay, good. I'd like to go back to the education of a pharmacist. So at the University of the Sciences, when you went to pharmacy school, what are some of the typical things that you study and that they train you on so that you can be a good pharmacist?
Well, it's funny because you really don't use a lot of your training until your last couple of years. So you do a 4-year under degree, you get biology, chemistry, all those things. And then they start to teach you about how the body sort of works, anatomy, and then they start to teach you how drugs work in the body. So they sort of build up and sort of give you an idea of science in general, and then they sort of teach you about the body, and then they start to teach you about the drugs and how they work on the body. And then the last year you work basically hand in hand with other pharmacists and you really get some experience as being out there. I think being a retail pharmacist, which is what I am, is 50% the knowledge that I learned from school and 50% of just working and being there and talking and experience.
Yeah.
And I think that's like any job too.
Yeah. I understand, and this may be true or not true, but someone told me along the way that now when you go to pharmacy school, you graduate with a doctor's degree?
You do. You get a Pharm.D. So technically you're a pharmacist. And it's a 6-year degree. And the last year you basically go on what we call rotations. And you basically round with the doctors, you round with pharmacists, you go to hospitals, you do all sorts of different settings. And it's a great learning experience. You get to see a whole different world than you see at school. But yeah, you do. You graduate with a doctorate.
Yeah. So I should call you Dr. Szilagyi.
Please don't.
Now, I've heard about something called CBD. What is that?
Great question. You've probably seen it everywhere. So CBD stands for cannabidiol. And it's actually a chemical that comes from the hemp plant. And the hemp plant is actually the brother of the marijuana plant, which I'm sure we've all heard of. It's in the news everywhere. So CBD is a component that goes into your body and helps sort of relieve certain conditions. One is anxiety, sleep difficulties, and inflammation and pain. So basically, you'll see it everywhere. My tech said the other day she saw CBD products in Bed Bath & Beyond. So it's a real trend right now, but there is some science behind it, and it has been shown to help people, help reduce pain, inflammation. I have a patient who was using a lot of pain relievers, a real significant amount, for years and years and years. And she decided to start some CBD oil, and it actually seems to help her. And she's reduced significantly the amount of pain relievers that she's been using. So there's something there. We don't really know exactly what, but it's certainly a new science that may be helpful to patients.
Yeah, okay. We have about a minute and a half left, but what are some tips that you could leave for our viewers about the proper use of drugs? Or
Well, you know, I think the biggest thing is good communication. And like in anything, communication is key. We at the Gateway Pharmacy always try to be there for our customers and our patients. So if you have questions, give us a call. We're always available to talk about things. And if you sort of don't feel well or something's wrong, make sure you talk to someone, your pharmacist or your doctor. Because a small thing can certainly snowball into a larger problem, and it needs to be taken care of quickly.
Okay. Well, thank you, Mark, very much. This has been really educational.
Thank you, sir.
Appreciate it's a great public service that you've done, so thanks.
Thanks for having me.
Happy to here. Well, that's about all the time we have for the show today, folks. We hope that you've enjoyed it and that you found it informative and helpful. Until next time, once again, thanks for being with us on For the Health of It. I'm Lou Beccaria, and remember, folks, if you're healthy, you're wealthy. We'll see you next time.